Hi, it's Susanna with Science with Susanna. Today's video is about your hip bones and your lower limb, all the bones and markings that your anatomy teacher will ask you. Let's get started. I want to start by looking at the lower limb as a whole. So this is the lower limb, and this picture on the left is of the right leg from the anterior view. So like you're looking at someone's right leg that's standing in front of you. Then the other picture is also of the right leg. I left the foot off most of it. And this is if that person was turned around. So you were looking at the back of their leg, or what we would call the lower limb. The pelvic bone we're going to color it red right here. You have two pelvic bones. They connect at the pubic symphysis right there. And then they also attach to the sacrum. That's not shown in this picture. And you can see it here from the back. That hole right there is called the obturator foramen, passage for blood vessels and nerves. We'll put this in red, and this is the pelvic bone in red. It is also known as the coxal bone. I don't like calling it that though, because I feel like students might get it mixed up with the coccyx, which is the tailbone. But just so you know, it does have that other name. The next bone in the lower limb is the femur. This is the biggest bone in your body. You want this thing real strong. Lots of weight-bearing activity when you're an adolescent, okay? And then for the rest of your life, do what you can to make sure you keep up on that weight-bearing activity. Here it is from the backside. This big bump up here is called the greater trochanter. Whenever there's a bump on a bone, that is a shout out to you to say, whoa, this is getting a lot of pulling on it, or this is an important place of tension. The bones get bigger in places where there's more strain on them. Femur in blue. Then we come to the patella, which is the kneecap. You can only see this from the front. I love the patella. It's a little bone that's actually encased in tendons. So it's called a sesamoid bone. And it really gives a lot of extra leverage when you bend and extend your knee. It protects that front part of the knee too. Next, we come to what's actually called the leg. Most of us think of this whole thing as the leg, but in anatomy, technically, the lower part of the lower limb is called the leg. So you see it from the front. Notice that this big tibia, that's what I'm coloring here, is the medial of the two bones. And it forms the medial bump on your ankle. Tibia. And then just lateral to that, we'll make the fibula orange. So here's the fibula. It's lateral. There's a little joint between the tibia and the fibula at the top. A little bit of movement at that one. But then down here at the bottom where the fibula is attached to the tibia, that is an immovable joint. And you can see it here from the back. Again, it's the lateral one. And it forms the big bump on the outside of your ankle. Fibula. Then we come to the ankle. These are called your tarsal bones. In the ankle, there are only 7 tarsal or ankle bones. In your wrist, though, there are 8 carpal bones. That calcaneus, your heel bone, is so big, it's like the size of 2 in the wrist. Oh, here. And then on this side, I only did the talus, which is the one that comes under the arch of your lower leg. We'll make the metatarsals pink. You have 5 of those, and they're equivalent to your metacarpals in your hand. Like that. And then we come to the very cute little phalanges. Make those. Your big toe only has 2, And then all the others have 3. And this is like your hand as well. Your phalanges in your hand, you have 14, and you have 14 phalanges in your foot. So the thumb and the big toe, they both only have 2 phalanges. The pelvic girdle actually includes the pelvis bones, but also the sacrum where they connect in the back. This includes the hip bone and the sacrum. So the hip bone, I'll outline it right here. It receives the head of the femur. Then it comes around like this. This is basically the one pelvic bone. And then over here is the other one. Oh, it looks like I forgot to put obturator foramen in that one. There. So those are the 2 pelvic bones. And the hip bone includes 3 regions. When you are developing, these are actually 3 separate bones that then fuse. 3 regions include, number 1, the ilium. That means like wing, it's very broad. Number 2, the pubis, that's the one in the front. And number 3, the ischium. These all fuse together to form where the head of the femur fits into the pelvic bone. This right here and on the other side is the sacroiliac joint. You'll hear it called the SI joint. Down here at the bottom, this is the pubic symphysis, where the 2 sides of the pelvis are joined. This particular joint is taught to anatomy students as what's called an amphiarthrosis. Amphi means both, and arthro means joint. So it means we have some movement at this joint, and it is a fibropad like a meniscus. The third joint on here is this joint between the head of the femur with the acetabulum, which is part of the pelvic bone. So here's this third joint. And this is the actual hip joint. It is a diarthrosis. Diarthrosis means that it can freely move in different directions. And it's classified as a synovial joint, meaning it has a joint capsule with a synovial membrane that lubricates the joint when you move. This specifically is a ball and socket joint. You only have 2 of these in your body. One is your shoulder and one is your hip. It has a great range of motion, but it's sturdier and less mobile than your shoulder joint for obvious reasons. It has to bear a lot more weight. So those are our 3 joints. The regions of the pelvis, I'm just going to color one side over here and color this in. This whole part is called the ilium. And it goes, make a line, goes to right about here, just estimating that. There's the ilium region. The pubis region, take your color and go right here and maybe something like this. This is actually the most anterior part. So your pubic bone juts out to the front of the pelvis. And then see how it's where the pubic symphysis is, that fibrocartilage pad that forms the joint between the 2 front sides of the pelvis. So this is the pubis. Then the back of the pelvis, where your sit bones are, is called your ischium. Let's look more closely at the three regions and the markings that are on them. There's a hole right here called the obturator foramen. Maybe it's not a surprise that this is a passage for nerves and blood vessels. The other nice thing about this is it decreases the bulk or the weight of the pelvis so that we can have strength without adding another ounces of bone to have to carry around all the time. So it decreases the bulk and weight of the pelvis. And it's formed by the pubis and the ischium, which we'll look at here in a second. Then the other kind of shared part of the pelvis is the acetabulum. It means literally vinegar cup. And it articulates with the head of the femur. This front part of the acetabulum is partially made up of the region called the pubis, which when it juts out to the front, because we're looking at this from the side, this is a right pelvic bone, and it's looking at it from the side, so it's a lateral view. So that means that this is anterior on this bone, and then this would be toward the back, posterior. The main marking on the front of the pubis right here is the pubic tubercle. So it's a bump on the front. And one of its importance is that it is going to be a place where the inguinal ligament will attach. And that helps to sort of form the border of your pelvis and your groin, like to mark the bottom of your pelvis from your thigh. The inguinal ligament attaches here. And also your rectus abdominis muscle, your abs, will attach here. So that muscle is going to attach there and then go all the way up to the bottom of your rib cage so that you can bend your body for a sit-up, for example. The back part of the obturator foramen and of the acetabulum is formed from the region called the ischium. Right here is an important marking. See how pokey that is? Called the ischial spine. I have a lot to fit. Let's start over here. So this is the ischial spine. And then the curve that forms right underneath that, right here, this is called the lesser sciatic notch. There's also a greater sciatic notch. And it's a passageway for some nerves. Body part that sometimes yoga teachers will call your sit bones, right here, is on the ischium, and it is called the ischial tuberosity. It's a big bump. And remember that big bumps indicate strong muscles are attaching there. And sure enough, at this spot, we have some of our hamstrings. Those are the muscles on the back of your thigh, like your biceps femoris, your semitendinosus, your semimembranosus. And those are strong, right? So they attach there. And the ischial tuberosities are important in a female's pelvis because they will point more laterally, and by doing that, they widen the whole pelvic outlet. That reminds me that I had wanted to show you on here that this opening, the distance from here to here, marks the pelvic inlet. And then if you're looking at it from the underside, it's the pelvic outlet. But this is always going to be wider in a female. And so see these ischial tuberosities? They point a little wider and they make this whole angle here a little bit wider for the baby to be able to fit out of the birth canal through that pelvic outlet on the underside. So back to this picture, they point laterally in females for a wider pelvic outlet. The third and biggest region of the pelvic bone is the ilium. Which I think means wing, but sometimes one side of it's also called the ala, which also means wing. So that's the whole ilium. See how it makes up the top of so you've got the top of the acetabulums from the ilium, then it's fused with the ischium and the pubis. So the three of those form the socket that the femur fits into. What you might think of as your hip, the top of it anyway, this whole region going along the top is called the iliac crest. And some muscles attach here, such as your oblique abdominal muscles, the ones that help you to twist. And also an important back muscle called the latissimus dorsi anchors itself here. And then it goes all the way up to your humerus so that you can move your arm. Front part of the ilium, the most anterior, pokes out a little bit, and that is, it's got a long name. It's called your anterior, I'm just going to abbreviate that, superior, going to abbreviate that, iliac spine. You can feel this if you reach down and try to feel your hip, what you might call your hip bones. You can feel that little spine. And it's abbreviated ASIS. Sounds like a shoe brand, doesn't it? Thigh muscles, such as the sartorius, attach here, and the tensor fascia lata that runs down the side of your leg. I love that muscle. The tensor fascia lata, the tensor fascia lata. The inguinal ligament that I mentioned to you that attaches on the pubic tubercle, it starts here. The whole thing, like I said, makes a border then. I'm going to put this here, but then erase it. See, it goes from here to here, and it forms a border to define the lower part of your pelvis and give it more stability between where your pelvis ends and your thigh starts. Now, with the long name like anterior superior iliac spine, what do you know? There's also an anterior inferior iliac spine. So anterior, because it's on the front of the bone. Remember, this direction is anterior. But it's lower than the other one. So it's anterior inferior iliac spine. And then as if that weren't enough, there's also posterior one. Right back here, you can see how you can see it. You don't have to it's not hard. You can find that easily. That is the posterior inferior iliac spine. Let's see if we can fit all of that. I'm going to try to give myself a bit more room because I have a lot to put here. So it's the posterior inferior iliac spine. That's this structure right here. A ligament that helps to secure your sacroiliac joint attaches here. So it helps with pelvic stability. And probably problems here are going to lead to back pain. Next, you can see, I think I'll do this one yellow. Look, right here, this is the greater sciatic notch. So we had the greater sciatic notch is right here, and the lesser sciatic notch is just below it. Makes sense, right? One's bigger and one's smaller. So this is the greater sciatic notch. And this one actually does have the sciatic nerve go through here as it comes out from the vertebrae. So it's a passage for the sciatic nerve, which is the biggest nerve in your body. And a muscle called the piriformis passes through here. So sometimes when that muscle is tight, people can get sciatic pain, which can go all the way up and down their leg. You might hear this part of the ilium called the ala, which means wing, because it's broad and flat. What I think is cool about it is you can see lines on it where the gluteus maximus is going to attach. So I'm just going to represent that. This is not perfect by any means, but you've got kind of these thickened lines. And remember, wherever a part of a bone is thicker or pokes out, things are attaching there, and that's why it got stronger. So those are the gluteal lines. And the gluteal muscles attached there. I'll put a few squiggles so that when you're looking at your notes, you can remember that this is what I meant on the picture from that. Here I want to emphasize the difference between a male and a female pelvis. I'm just going to highlight 3 big differences. The first big difference is that females have a wider pelvic outlet. So you can see this here. This is actually called the inlet, this part right here. But from here to here is called the pelvic inlet. And then the outlet is if you were looking from it from the underside, and it would be even bigger there so the head of that baby can fit out. Now look at the male side. See how much narrower that is? So that's one difference. Second difference for the female pelvis is that there's a wider pubic angle. Notice that everything is just wide, and that's good for delivering a baby. So that would also be for the females. So look at this. See this angle? See how it's wider? And then in the male, it's going to be a more acute angle or narrower. This just happens because of the way the pelvis fits together. The sacrum's actually wider on the female too, and a little bit shorter so that there's more room for the baby to fit out. I'll give you one more difference, and that is that because of the way the pelvic bones fit together on the female, the ischial tuberosities, remember on the back, they kind of point to the sides. They point laterally. And that, again, just gives more space in the pelvic outlet. They point out to the sides. And that's also in females. So these are all 3 differences. If you look here, this is where this would be, and see how you can't really see it in this picture, but it flares out to the sides, and it does not do that in the male pelvis. It's going to point more toward the middle, which is going to make that pelvic outlet smaller. Next up, the femur. This picture is the right femur. Everything I'm doing in this video is always from the right side. And the femur is the biggest bone in your body. The sciatic's the biggest nerve, and the femur's the biggest bone. And the gluteus maximus is the biggest muscle. And the liver's the biggest organ, internal organ anyway. So this view is an anterior view, which makes this the medial side, okay? Keep that in mind as we're going through this. And then this one would be looking at the bone from behind. And again, see the head of the femur? That's always going to be your medial spot. So you can always figure out which is pointing medial by that. The articulation surfaces. Here's the head of the femur. And over here too. This fits into the acetabulum. So the head articulates with the acetabulum. To form your hip joint. Then we have to go down to the bottom of the bone to find the other articular surfaces. At the back side on the bottom, there are these rounded projections called condyles. And these are the medial and lateral condyles. And these are going to articulate with the tibia. Of the lower leg. Now, if you are wondering which one's the medial, this is going to be the medial side, right? Because you find the head of the femur up here and then trace that down and you can see that would be the medial side then. There's also an articular surface on the front of the bone where the patella is going to fit, and that's right here. So this is going to articulate with the patella, and it's called the patellar surface. Going to go back up to the top of the bone, right up here. And this is the neck. You can see it on both sides, which would be called the neck of the femur. Then there's a big bulge right here. You can see it from the front, and then if you look at the back side, you can see it here too. This is called the greater trochanter. It's the biggest projection on a bone. It's the only trochanter in the body. That's so big. So that's in red. And the greater trochanter serves as the location for the gluteus medius and minimus to attach. And the piriformis attaches here in this vicinity. And muscles that help to rotate your thigh laterally, we call these lateral rotator muscles. How do you spell rotate? Is it like this? And also, not all of your quadriceps, but quads, some, because the rectus femoris actually starts up on the pelvis. But there are some of the front of the thigh muscles that will originate here on this big bump. There's a smaller bump a little bit lower down. We call that one the lesser trochanter. Just like we had the greater and the lesser sciatic notch, we have a greater and a lesser trochanter. And an important hip flexor muscle called the iliopsoas. It's actually formed from two muscles, but I like to just teach it as one. It's your primary hip flexor. Connecting those is a visible line on the front of the femur, and it's called the because it's between trochanters, because it's between the trochanter's intertrochanter line. And once again, we're going to have some more quads that are attaching along this spot. I'll just put some. On the other side, on the back side, you can see what's called the intertrochanteric crest. Here, I'll zoom in. This is right here. Between the two trochanters again, but it's on the back side. And you notice it's thicker too, more prominent, just bigger. So that's the intertrochanteric crest. The iliofemoral ligament attaches here. So it's going to go from the ilium to the intertrochanter crest and helps to stabilize the hip joint to keep the head of your femur into the acetabulum. Also on the back or the posterior view right here is what's called the gluteal tuberosity, the thickening of this part of the bone. And the importance of that gluteal tuberosity is that the gluteus maximus attaches here. And then the last marking that I'll have you learn is just right here. We call this that you can see along the back of the bone right here. That is the linea aspera. Like literally means line. Specifically, there are some adductor muscles that help to adduct your thigh, bring your legs together, and hamstring muscles can attach here too to help bend your knee. Patella. The patella sits on the front of the femur and it fits into the patellar surface on the femur. And it has a couple of really neat jobs. One of those jobs is just to help protect the front of the knee. You can get hit pretty hard here. Another thing to know about the patella is that it's a sesamoid bone. A sesamoid bone is one that is embedded in tendinous tissue. Its location helps to give better leverage when the knee is bending and extending. See right here, this is called the quadriceps tendon. So this bone's location increases the leverage or the strength of motion. It also provides some important stabilization. So the quad muscles attached to the patella, which is then all encased in this tendinous tissue, and then that inserts down onto the tibial tuberosity. So the patellar ligament, it's a misnomer, it's actually a tendon. Connects the quadricep muscles to the tibia. And then the patella stands in that gap to strengthen, support, and increase the leverage when those muscles are acting on that location. So this is the patellar ligament. This is the quad tendon. And then that little sesamoid bone is securing everything in place. Here we'll look at the right tibia, both with an anterior view on the left looking straight on, and then a posterior view, the back of it. And actually, I have the fibula here too, don't I? So right tibia and the fibula. Since we were just looking at the femur and talking about how it articulates with the tibia, you can see that here, these spots here, and then from the back, these are called the tibial condyles. They're not rounded the same way the condyles are on the bottom of the femur, but they're still called condyles. So this is the medial and the lateral condyles. And I can tell that a couple of ways. One is because the tibia is the medial of the two bones. Actually, that's the easy way to tell. So you find the tibia and then you know the condyle on that side. So if it was here, then it's medial and here would be lateral. So medial and lateral condyles, and these are going to articulate with the femur to form the knee joints. The knee joint is considered a diarthrosis because it has free range of motion, and it's also considered a synovial joint by its structure. It has a joint capsule with a synovial fluid inside, and it's a hinge joint, meaning it can flex and extend. It does not have the same range of motion as your elbow, which is a hinge joint but also can pronate and supinate. The reason that this leg doesn't have the range of motion that the elbow does is because this joint right here and here, the tibiofibular joint, doesn't have the same amount of movement. Indeed, down here at the bottom, right here, and you can see it here, where they come together on the bottom, that's actually an immovable joint. We call this the distal tibiofibular joint. And unlike the knee joint that's a diarthrosis, meaning fully movable, instead, this is a synarthrosis. That means that it doesn't move. And it's made out of fibers, collagen fibers, and so it also gets classified as what's called a syndesmosis. So this is an immobile fibrous joint. The two bones are also connected with a membrane called the interosseous membrane. Inter means between and osseous means bone. So they're held together, but it's not solid, and that is going to help lighten it. That's the interosseous membrane that I just colored in yellow. Right between the two condyles is a part that pokes up. You can see it here and here. It's called the inter because it's between, condylar because it's between the condyles, and eminence because it is prominent and it pokes up. Eminent means like obvious, or sometimes it means important. And this is where two really awesome ligaments attach. Your ACL, your anterior cruciate ligament, and your PCL, your posterior cruciate ligament, attach here. And that's going to obviously be super important in joint and knee stabilization. On the front of the tibia and up pretty high is a thick protrusion called the tibial tuberosity. And the tibial tuberosity is the insertion point for your quadricep muscles. Remember I was saying they come down over the patella? So your quad muscles insert here. And that's why it needs to be so big. The more a part of the bone is pulled on, the more that it will get bigger and stronger. Running down the front of the tibia is what you would call your shin. It's the anterior crest because it's on the front and it's a ridge line. You would call that your shin. And a muscle that if it hurts, you say you have shin splint called your tibialis anterior attaches here. And that helps you point your toes at the ceiling. Coming down to the bottom of the bones, you have the outer ankle bulge called the lateral malleolus. Looks a little bit like a mallet. That's why it got called malleolus. Looks like mallet, right? On the medial side, there's also a malleolus, but it's called the medial malleolus, and it's on the tibia. And these are both easily palpated with your hands. You can feel the outer ankle bump, that's your lateral malleolus, and your inner ankle bump, which is your medial malleolus. And both of those serve as attachments for ankle ligaments. If you sprain your ankle, some of these got stretched or even torn. The last structure I want to point out is the head of the fibula, both here and here. The head of the fibula. And that's an important attachment point for knee ligaments. The lateral collateral ligament, also known as the fibular collateral ligament, attaches down from the lateral side of the femur down to the fibula. And then the medial collateral ligament, sometimes called the tibial collateral ligament, attaches from the medial side of the femur down to the tibia. Last, we'll look at the foot bones. Recall that this is the tibia, and then this would be the fibula. And just like I've done in the whole video, we're looking at a right foot. This is an anterior view. And then over here, this is going to be looking at it from the side, lateral view. What we did with the pelvis, actually. There are 7 tarsal bones. That word tarsal means ankle. And there are 5 metatarsals. And just like the hand, there are 14 phalanges. The difference is that you actually have 8 carpals instead of 7. And that's just because one of the tarsals is so big, it's the size of 2. In fact, I'll show you over here. Here is the calcaneus. This is the heel bone, and it's huge. Calcaneus means heel. You can't see it as much from the front, imagining a little bit, but it's right there. And then the bone that articulates up underneath the tibia and the fibula is called the talus. That word talus means ankle or the knuckle of the foot. Then just in front of the talus is my favorite ankle bone, and it's called the navicular. It's where we get the word navy from, navicular, because it's shaped like a boat. So the Navy, those are soldiers that go in boats. Just in front of the navicular are 3 wedge-shaped bones called the cuneiforms. I think that word cuneiform means like wedge. Cuneiform writing, and you've got 3 of them. You've got the medial cuneiform, which is the most medial, so that would be this one. And then the intermediate, it's the one in the middle. And then the lateral. Boom, like that. If we draw these over on the side view, this would be the medial, this would be the intermediate, and this would be the lateral. See how they're all right in front of the navicular? That's how I always find them. I find the navicular first, and then I know I can find my cuneiforms. The talus is unmistakable, and so is the calcaneus. You can't get those wrong, right? The last one is called the cuboid, for its kind of boxy shape. Right here and here, the lateral view, the cuboid. The boxiest shaped one. So we can number them. You've got 1, 2, 3, 4, 5, 6, 7. Let's look over on the lateral view. 1, 2, 3, 4, 5, 6, 7 for all 7 tarsal bones. The metatarsals, you start counting at the big toe, just like we started counting in the metacarpals at the thumb. 1, 2, 3, 4, 5. And then over here, see, you'd start on the lateral view, you'd start here. 1, 2, 3, 4, 5. We can number those too. 1, 2, 3, 4, 5. And then on the anterior view, 1, 2, 3, 4, 5. Then all we have left are the phalanges. And if we look on this anterior view, the big toe, just like your thumb, only has 2. And then all the rest have 3. 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3. And over here on the lateral view, 1, 2, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, for a total of 14 of those phalanges. So these here are the names of the tarsals. Okay, I hope this was helpful. I will see you in the next video.